I want to help you understand how to think through nursing school questions. Many students struggle with exams in nursing school, not because they don't study, but because nursing questions are written differently than questions in most other classes. Instead of simply asking you to remember information, nursing questions ask you to apply your knowledge to patient situations, and they want you to make clinical decisions. So the goal of this video is to help you understand the difference between knowledge questions and application questions. This will help you to eventually break down these questions so you can think through them more confidently on future exams. So let's get started with how to think through nursing school questions, knowledge versus application questions. We're going to focus on 5 main things. First, we'll look at the definition of what a knowledge level question is. Then we'll talk about application level questions, which require you to use what you know to make a decision about patient care. We will then discuss the key difference between these two types of questions so that you are able to recognize and understand what's being presented on your exams. I will also show you some common wording used in application questions because recognizing these words can better help you understand what the question is really asking. And finally, we will go through several examples together so you can actually see how to work through these questions step by step. Before we look at examples though, it is important to understand that most nursing exams, and even the NCLEX that you're going to take, focus heavily on application level thinking or even higher. This means it is not enough to simply just memorize information anymore. That time is long gone. You must be able to look at a patient situation, recognize the problem, and then determine what the nurse should do to keep the patient safe. Remember, NCLEX is all about patient safety. What you see here on the screen is Bloom's taxonomy. This just shows you the level of understanding or knowledge needed as you progress through different types of learners' questions. It starts off with the purple circle, remembering, and then it goes to understanding, applying, analyzing, evaluating, and then as you progress through understanding material, if you can start to create information, then that is the highest level of Bloom's taxonomy. We are just going to talk about the understanding and applying today. So, what is a knowledge level question? The definition of knowledge level is that it is a question that asks you to simply recall a fact or a definition. It's very straightforward. You could put this on a note card, memorize it, and be able to recall the answer. There's no additional levels of thinking with knowledge level questions. So let's look at this practice question. It states, which electrolyte is most important for cardiac rhythm? Sodium, potassium, calcium, and magnesium. This information, again, could be presented on a note card. You could memorize it. It's very straightforward. So what's the answer? The correct answer is potassium. Straightforward answer, just required you to recall a little bit of information, mostly a definition or a fact, and then you kind of moved on from there. But let's look at what an application level question is going to ask of you. This definition states that it requires the student to use nursing knowledge to make a clinical decision in a patient scenario. So now memorizing facts might not always come in handy. Those note cards that you use for knowledge-based questions, those probably are not going to work anymore. You have to figure out a way to study to make the information work for a patient situation. Sometimes I like to tell you guys to use your imagination. Come up with a patient, picture that patient, and that'll help you figure out these questions. So let's look at the example. A patient's potassium level is 2.9. What is the nurse's priority action? So your question here is an action. What are you going to do as the nurse? They gave you the patient's labs. That is your scenario. But now they're asking you to go further. It's one thing to memorize the labs, but what do you do about them? So that is our next step into the application level of Bloom's taxonomy. Your options for this question are, would you encourage oral fluids, place the patient on cardiac monitoring, document the finding, or recheck the lab tomorrow? So what do you think your answer choice would be here? If you picked placing the patient on cardiac monitoring, you are correct. One of the biggest things with potassium levels is that we do have to monitor the heart with even the slightest changes of either elevated or lowered levels of the potassium. So again, knowledge level would be potassium affects the heart, but what do you do for it? And that is where we go to application level. So what's the key difference? Knowledge questions are going to ask you, what is it? Simply put, give me the definition or recall the fact. No more thinking required. Whereas our application questions, they're going to ask, what should the nurse do? What assessment will you do? What intervention will you do? Will you have to give a medication or instead give oxygen therapy? Do you need to educate the patient? And if you do, what would you educate them on? This is where we're going to start using our applied information. In other words, the question is going to start asking you to think like a nurse and make a decision about patient care. This is why students who only focus on memorizing information sometimes struggle with nursing exams as we get through more semesters in the nursing program. Application questions often include specific words that will help signal you or give you a hint as to what you must be thinking about. Usually this is going to be focused around prioritization or patient safety. So let's look at some common wording that you might see. Now this is just the top 4, but there could be others. A question you see a lot is, what is the priority nursing action? So your answer choices will all be nursing actions or interventions, but you're going to have to pick what is the priority. So they all might be right, but what is the best one? And we'll talk about priority later in another video. Another common question would be, what should the nurse do first? This is very similar to our first question, just rewording it in a different way. Again, they're all going to be answers that are probably correct, but which one do you want to do first instead of last, for example? Which finding requires intervention? So in this case, all of your assessment findings of the patient, they all might be abnormal, and you have to pick the best one that requires you to do something first. Or you might be given 3 assessment findings that are wrong, and then 1 that is abnormal that you would actually have to do a nursing intervention for. Which patient should the nurse see first? This is always a good question to get because this is going to basically put you out on that clinical floor and make you think. If you had 4 or 5 patients under your responsibility and they all have their own problems, which one would you need to go see first and why? It starts really making you think, what would the nurses do? When you see words like priority or first, this means the question is asking you to determine the most important action for patient safety. Now, these types of questions, they require you to slow down, read the question, sometimes even reread the question, and really think through the situation carefully. Now let's compare a knowledge question and an application question. Let's see if you can see the difference. So the knowledge question asks, what is a common complication after surgery due to immobility? Very straightforward. What is the complication? You could even get rid of everything else in that question. What is the common complication? You're looking for a specific complication. Straightforward fact, what do you know? For this question, the correct answer is pneumonia. Again, this question simply tests whether you know the complication or you don't. But now let's look at the application question, something similar. A postoperative patient reports shortness of breath and chest pain. What should the nurse do first? So let's highlight or bold that first. Some of your answers, they might all be right, but you're going to try to pick which one do you need to do first. Which one is the priority? Which one is the most important? Which one will make the biggest difference in your patient? So when you read this question, the first step is to identify the patient problem. Shortness of breath and chest pain could indicate something serious. So as the nursing student, we want to think, what could that something serious be? Of course, if you've been through postoperative care, you might recognize that this could be a sign of pulmonary embolism or a blood clot traveling into the lungs. So what would we want to do for this patient? Would we want to encourage coughing and deep breathing? Would we want to administer oxygen via nasal cannula, assist the patient to ambulate, or document the findings? In this case, the most appropriate answer is to administer oxygen because the patient is experiencing respiratory distress, and oxygen would help address those breathing issues immediately. And how do we know that the patient is in respiratory distress? Well, in your scenario, if you imagined you walked into your patient's room, they have shortness of breath and they're complaining of chest pain. Those are our symptoms. So this is an example of applying your knowledge that you know about pulmonary embolisms in order to create an intervention so you can protect your patient. Let's do one more so we can see the difference again. This is going to be an example involving diabetes, so something a little bit different. The knowledge question asks, which symptom is associated with hypoglycemia? Is it going to be increased thirst, sweating and confusion, frequent urination, or dry skin? Now, there's a lot of words listed in these answers, however, it is still very straightforward. It's a fact or it's a recall. You either know the symptom or you don't. The correct answer here is sweating and confusion. So this question, this knowledge level question, simply asked you to recognize symptoms, and that was it. Straightforward, could have been on a note card, you just memorized it and you moved on. But let's go further. Let's look at the application question. This is going to be the type of questions you get moving forward in nursing school. A patient with diabetes becomes confused, shaky, and diaphoretic. What is the nurse's first action? So we first want to think about, what are all of those symptoms that the patient is experiencing? What is that telling us? Well, those symptoms tell you that the patient might be experiencing hypoglycemia. So then your next question in the root of your question here says, what is the nurse's first action? Action meaning you need to do an intervention. So all of those interventions that you learn in class. But it's asking you, which one do you want to do first? So before treating the patient, the nurse should do what? Would they administer insulin? Is that going to help for hypoglycemia? Would they check the blood glucose, notify the provider, or document the symptoms? So if your patient is having symptoms, we always want to do a brief assessment. We want to get more data. So what answer would give us more data? Well, before treating the patient, we want to make sure that we check the patient's blood glucose level. This would confirm if our suspicions about the hypoglycemia are correct. Once we check their blood glucose, then we could use our clinical reasoning to move forward from there. What do we need to do with the blood glucose? Do we now let the provider know? And so on and so forth. Again, this application level is trying to get you to use your clinical reasoning to make clinical decisions to keep your patient safe. So let's review the key points from this video. Knowledge questions ask you to simply recall facts, definitions, or symptoms. Application questions, though, ask you to apply your knowledge to a patient situation and decide what the nurse should do. Most nursing exams and the NCLEX will focus on application and clinical decision making. When you answer these questions, try to follow these steps. First, identify the patient problem. Figure out what actually is going on first. Get an idea of what you're going to be walking into the room for. Second, pay attention to keywords like priority, first, or what requires intervention. Third, think about patient safety and what action should the nurse take. If you choose this action over another action, is it going to be safe? Is it going to give you the best results quicker? The more you practice thinking through questions this way, the more confident you will become when taking nursing exams.